Asbestos is a known carcinogen, and there's no safe level of exposure.
Mesothelioma is a miserable disease.
They must fight a truly global battle.
We want to demonstrate our enormous respect.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Keep me in your heart for a while.
Great, thanks so much. Sari Sairanen, I'm the Director of the Health and Safety Department for the Canadian Auto Workers Union, and I'm so glad to see that there were some other trade unionists here as well, even though we may not have a common language, but we certainly have the common goal of looking after the interest of working people and working families. So what Alec and I are going to do is we're going to be a dynamic duo, because that's what we are in the community as well, is dynamic duo. I lean quite heavily on Alec and his organization to look after our members' interests, and he in turn leans on us to find out what are the trends that we're seeing in the workplaces and how we can best work together to find the solutions and find the laws that will protect workers. I'm trying to find this clicker, how it works.
I think it's this one on the right. There.
There we go. So as I said, I come from the Canadian Auto Workers Union. It is the largest private sector trade union in Canada. We represent members not only in the auto sector. I don't come from the auto sector. I come from the first organization that did merge with the auto workers is the airline sector. So I'm an airline worker. I come from a call center, and from then on we've merged into, or have merged other sectors into our union, virtually representing all of the economic sectors in Canada, going from coast to coast. So there's a fair number of workers, fair number of different industries, and also common issues that all of our members do face, and one of them is exposure to asbestos in their workplaces. And our philosophy is not just the bread and butter issues, but looking after the social justice issues as well that not only touch our families, our communities, but society at large as well.
So hello everyone, the second Canadian. As a young law student in 1973, the first people I started working with were the Johns Manville workers in the east end of Toronto and Scarborough. And some of them were Italian Canadian. They came all the way from Italy. They went to work at Johns Manville. They were making asbestos cement. It was the same struggle, the same issue, and at the very same time, Niccolò was going to work at Casale Monferrato's Eternit plant. So we're closing a circle after 40 years. Un piacere grande lavorare con voi. I speak Italian too. OHCOW. OHCOW is a labor-governed network of interdisciplinary health clinics in Ontario. We're fortunate to have a significant budget and resources. That was established a long time ago, over 20 years ago, by the labor movement in Ontario. We're labor-governed. We're funded by our Workplace Safety and Insurance Board. And in Canada, as you know, we have public health care and we have public workers' compensation. It makes a tremendous difference that a place like where I work is getting public money to do this work with organizations like Sari's and many others. We have teams of physicians, nurses, hygienists, ergonomists, so we can put those teams in play anywhere in the province. And as you'll see in a minute, and to follow someone like Debbie is just incredible. We try to serve people on a collective basis as they struggle for their rights and they struggle to move forward together. We try to help individuals come out of loneliness and suffering, come together, help each other, and form a force, and you can see what kind of force has happened here. What's our philosophy? We really believe, and you can just see from the wonderful experts like Arthur Frank and others here, they're very similar. Experts aren't just here to lord it over other people. We're here to share expertise, help build capacity, help build understanding in the workers, families, unions, and we have a lot to learn from you. It's not a one-way street. And we do a lot of work to try to develop, in collaboration with Sari and others, tools that can be used. Some of the kinds of things you've seen on screen here, ways that ordinary people at the front line can take control of their own situation. Now, we put a couple of slides in just to give you an idea. I'm not going to go into any detail. You can see it's the same usage curve as in all the other industrialized countries, followed by a curve which is very similar on the use in Canada. I just gave you one disease curve. This is the mesothelioma rates in Ontario. And you'll see that it's peaking right around now. We expect it will plateau over the next 10 years. And we're now around the level of 150 mesotheliomas in Ontario, around 500 in Canada, and it's estimated that 2,000 Canadians approximately are now dying every year from asbestos cancers. So we're telling the same story as the rest of you have lived in this room, and of course I've been involved in hundreds of asbestos disease cases. There are the numbers, and these are based on very solid estimates, and of course, as some of you have experienced, like Fernanda, there are ferocious efforts to challenge the science, ferocious efforts to prove this is wrong, and we have some wonderful allies in the epidemiological and public health communities right across Canada. So I'll go back to Sari and for the real grassroots experience of what's happening.
So when workers go to work, they certainly don't have this in mind that is today the day that I die when I go to work. That is not any of us have on our minds when we go to work and we kiss our families goodbye and say, see you at dinner time. And unfortunately, there are industrial accidents that do happen. But the most telling factor are the occupational diseases, and certainly mesothelioma, asbestosis are the issues that really galvanize the community and our union of what is happening to the workers in their workplaces, and what are the employers doing? Are they following their responsibilities as per the Occupational Health and Safety Acts in the various jurisdictions? And this is just a very small snippet of some of the workplaces that we have had close contact with asbestos and what our members have had to endure, and certainly the Holmes Foundry is a horrific example of negligence, of willfulness on the part of an employer and a government to go hand in hand with the employer and allow workers. And these were mainly immigrant workers that had come to Canada after the war that needed a job, and we're not going to rock the boat. We're not going to ask the questions from the employer. We're not going to raise a fuss. And certainly they've paid a price for that, and the community has paid the price. Air Canada, the employer group that I come from, call center had a fire, and the ceiling tiles were damaged from the fire, and the workers had to come back a day after the fire because you can't let a call go through, a potential sale, and the cleanup hadn't been done, and one of our members was exposed to the exposed ceiling tiles, and eventually she was diagnosed with mesothelioma. She'd been a white-collar worker. Where would that have come from? And they traced it back to that particular fire that happened at one of the call centers, and it was actually the call center in Toronto. General Electric, we're still battling today with hundreds of cases of exposures and families that are dealing with the after effects of asbestos exposure. Marystown Shipyard, there's a shipyard in Newfoundland that certainly had exposures to asbestos over the years, and again now going through the cases with the families. Some of them, before the cases get even accepted by the compensation board, you're dealing with the families, with the widows. University of Manitoba. You don't have to be a blue-collar worker to be exposed to asbestos. We had a scientist who was working in the lab and again exposed to tiles and contracted mesothelioma. Irvin Meritor, where we made brake pads for trucks. Up until the late 80s, they were still utilizing asbestos for truck brake pads, and we were able to get the employer to substitute that into non-asbestos fibers that they utilize. PPG Canada, again, another place where they had asbestos exposure, where they made windows. And again, many of these employers are no longer with us. So now you're dealing with their trust funds, you're dealing with the court cases, and you have a devastation that has been left behind to the families and the communities to look after. So our approach when we have issues that take place, catastrophic issues like that in the community, is who do we partner with? And that's really important, of looking at the partners who will look after the occupational labor's perspective of the cases that are at hand. And we're so fortunate in Ontario of having the OHCOW clinics, and that's what we shorten it to, the Occupational Health Clinics for Ontario Workers, OHCOW for short. And they're a very unique clinics in Canada. There are other clinics. There's one in Manitoba, and there is one being set up in British Columbia. But when you look at population of 34, 35 million, and you have 5 or 6 clinics to look after occupational issues with the labor perspective, it's very menial to look after those issues. So we look at partnerships that will give the labor perspective when we have cases that come forward from workplaces. We always made a reference to the OHCOW clinics going to work with the physicians, and also helping with compensation claims. When the compensation boards are saying that not enough evidence is there, where do we go and get further medical evidence? We turn to our partners, the OHCOW clinics.
So really, it's just the flip side of what Sari just said. We will not go into a workplace unless the workers are fully involved. There are a lot of consultants out there who consult with the employers only. We don't believe in that. We try to work jointly with the worker and the union and the employer, but sometimes the employer is very resistant. So we've been engaged in a lot of situations where we're just working with the workers or the union, and as people like Fernanda and the Italian representatives and some others have encountered, some of the people we work with have suffered repercussions for that. They've lost their jobs, they've suffered discrimination, and we have to be very careful to protect their confidentiality. Our partnerships are based on a mutual respect and commitment to real change in health and safety. Unfortunately, a lot of the prevention work that goes on right around the world is on the surface, so as long as the paper says there's a process or procedure that's found acceptable by the regulator, we push hard for real change. And I'll turn back to Sari in terms of the next stage.
So when we look at the community work that we do, is we can't do it in isolation, even though we may be a large organization in the grand scheme of things. But when you look at the bigger picture, we're just drop in the ocean. And we do need to have partners that we can work with to have that momentum and having the leverage in the community as well as in a political arena. Because unfortunately, it is about politics. It's getting to the politician to make the right laws, to make the right decisions, and also the economic pressures that are needed to make changes in the arenas of workplaces and the chemicals and the exposures that are occurring in the workplace. And you see some of the campaigns that we've worked on the exposures of asbestos and what it really means. And it is shameful that Canada is still exporting its asbestos, still mining the asbestos. We have members in Quebec that we work very diligently with on securing a complete ban of asbestos and shutting down and just transition of the workers in those industries. And it is a daily battle. It is not an easy struggle. It is not an easy cakewalk. You are struggling for people's survival, their economic fare, and there are some political issues involved as well with the autonomy of Quebec workers and the history of that. I'm sure you can sort of Google that. We don't have time to get into that, but there is always that big P politics involved in how you're looking at making changes in the community. But it is working with the community, because once the factory doors are shut, you're still part of the community. You can't isolate yourself from that. And we all live together, we all play together, we all go to the same grocery stores, enjoy the same amenities in our community. So you do need to have that partnership to move forward. And as you can see, the dangers of our Prime Minister Harper there on asbestos. Parliament Hill certainly is riddled with asbestos, and there are sections of it. There's huge signs like this all over Parliament Hill of the dangers of asbestos. But it's interesting how it is not so dangerous when you ship it across your borders and let others deal with it.
So just to finish off with how we work, and I'd really like to go back to Debbie's situation and that of so many in the room who experience it as an individual tragedy, and often, I mean, Debbie's very unusual for reaching out to so many others, but so many do get isolated and never find anyone else and never have their voice heard. And we try to empower the communities. We try to work collectively. We do this with intake clinics, and we're almost done here for Emily and the sign. Intake clinics are where we work in some very big workplaces, steel mills, big factories, and we send our team up there. We work with community volunteers, and we might see as many as 500 or 1,000 or more workers over a 2 or 3 day period in a community setting. We have people walking in right off the street with mesothelioma and other asbestos diseases. We try to help them get compensation, obviously, but also get involved together. And of course, we're strongly supportive of what you'll hear about tomorrow from Leah and Stacy and their mom, maybe, about the mobilization in Sarnia of hundreds of people. When we go into an intake clinic, we get people to share where they have a health condition. They put little dots on these big bodies up front, and it helps people understand that what they're suffering is not just themselves. Lots of other people are suffering the same thing. We get them to map out their workplace. This is actually a map. I think it's a map of a big workplace in the Peterborough area, General Electric. And the little dots represent different kinds of chemicals or exposures. I'm sure there's one there for asbestos and lots of other things. So that helps people see that they were all there in one place over a period of time, and they can share their knowledge about the workplace. It helps prove workers' comp cases and helps give people a sense of collective experience. And we'll finish off with Sari, because we are all one community, and OHCOW is part of it, as the union and as all the victims and their families are.
Yeah, and this last slide represents, yes, we are all one community working together, and when you have a collective voice, you can certainly make a huge difference in the actions of one to actions to many, and international action as well. So this is some of the events that we take part in, whether it's nationally, locally, or internationally, but certainly flying the flag of working people is very important, because they are usually the frontline ones who are exposed to deadly substances like asbestos, and it's not a lifestyle issue like some want us to believe, that you get certain diseases as a result of lifestyle. It is not. Occupational diseases certainly do come in many forms from our workplaces, and it starts there, the cleanup in the workplaces. Thank you.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Your heart